Namhlanje, we are here in Soweto, Tladi, and then from here we'll be going to Diepkloof. We already started in Alexander. The purpose of this program is to check on all our beneficiaries, those that have gone to the rehab centers before. We are tracking on them because some they do come out of rehab, come back to the townships, find themselves relapsing due to unemployment, sometimes no trust from family members. Others, they end up feeling disillusioned, they end up relapsing or also going or being recruited back by the syndicates that were actually selling drugs to them. So as the department, we are doing this outreach to check on them because we are busy also establishing halfway centers. We have many NPOs that we fund that do skills development. We also want to link them to those NPOs so that then they do go and do skills development. Thereafter, they'll be able to find work or find work opportunities. So others will check what is the condition, because remember as the department we're also responsible for sustainable livelihoods. Others, so that then we also assist them in linking them to our food bank, in ensuring that as they continue training, at least there is something to eat at home, and also workshopping and counseling even parents, because the non-trust also, it creates this problem that we are facing today, whereby because at home they no longer trust you, they no longer want to, they end up others being homeless, others end up sleeping in others they sleep here even at stations. So we're trying to bring back all those service users that we have managed to take to our rehab center so that they were able to chart a way forward for them. But they must be committed. It must be them that are actually ready to say they want to live this type of life, but also focus on ensuring that they improve their lives.
MEC, do we know the number of our beneficiaries here in Gauteng roughly?
We have more than 10,000 of them that have gone through our rehab programs since we started it in 2022, and currently our waiting list is still standing at 32,000. That is those that will be wanting to go for rehab. But we also will be opening new facilities, also working together with some NPOs and ensuring that we also place some of them in those rehab centers. But what is important, the engagement with those NPOs will also be having it next week, because we say to them, you can't just rehabilitate and that's the end of it. But you need also to assist us now, train them, link them to skills training, link them to job opportunities. Umuntu makabuyele ekhaya instead yokuthi na qhamuka bathi nango bafihla imali, qhamuka uphetha wakho amaplastic uthi naku ukudla, and be able to play a role, a meaningful role even in communities. Others, they can even go and do some programs and projects and be able to recruit those that don't believe that rehab does happen, but be able to talk to them and link them and be able to say to them, there is life after having been on the substance abuse, and they can be able to say to them, we are moja, we are fine without drugs. That way we see more and more young people actually being better, and after school, no bullying, no nothing, but they know that they can live a better life.
And any last words to those who are still using drugs, MEC?
Wish to call upon all of them to say such opportunities, when we announce them as the provincial government, they must take advantage of them. We'll also be having another mass admission during the month of October. We'll announce the venue where they can come, and people must come ready. They should have gone to the clinics, but we'll also be having health on site so that they are also, we check their health statuses as and when we admit them. Then we know that it is people that are really dedicated. Of course, some parents will have pulled their children to come. Well, it's because of the conditions with Bakae. But sometimes we want a person who is now ready. But if are ready, then we don't have those that then discharge themselves before time. But they go through the whole program until they complete it. And when they come out of rehab, they are better off and they're able to go and interact and live happily with their families.
Thank you,